I'm Dr. Peter Paul Eriki, actually based in Uganda, in East Africa, as you can see. Now, the most interesting thing is that I started from a very humble background. Went to university in Makerere University, where I did, of course, MBS CHB, and then also went back and did a degree in internal medicine and specialized in internal medicine. After that, I went to UK, where I did a high diploma in tuberculosis and chest medicine in University of Wales. After that, I went to Harvard University in US, where I did, of course, naturally, when you do tuberculosis, you are drawn to a disease which is a public health concern, and it's a disease of people. And therefore, you need to know public health as well as epidemiology. I turned that and then came back home. I was made to head the national program of tuberculosis. And during the practice, which of course I should have mentioned for internship, just going one step back, I was posted to a rural hospital, a 100-bed hospital, a single doctor, literally operating every day. I cannot remember how many cesarean sections I did during that time, but it was a very rewarding experience. One, it brought me closer to how people actually live in communities. Secondly, giving service with dedication propels you to the future. And indeed, it set my future. And then that, of course, made me access quickly going back to the university to do master's degree in internal medicine, which I enjoyed. During the process, I realized there was a problem of tuberculosis. So I got inclined in that direction. And indeed, I did internal medicine, went and specialized in TB and chest medicine in UK, and as I mentioned, eventually went to Harvard University, where I got much more knowledge on how to handle public issues. Not only living with a numerator, but also having a denominator with you to appreciate where are these people coming from. During the time of my practice, there came one catastrophe. I started seeing the tuberculosis changing. Instead of having cavitatory disease, which was classical in TB, it was becoming miliary in nature, even in adults. That was the coming in of HIV/AIDS. And indeed, I saw this and I described it in one of the World Conferences of AIDS, which took place in Stockholm. I spoke about these changes. Little did I know, this discussion was going to lead me to people looking for me, and I was invited to Geneva, headquarters of WHO. The purpose was to let the world know how can we work across these two programs. Both of them affect the same individual, and the manifestation at that time, the AIDS people were going to their special clinics. The TB people were being treated separately. I told these people that this problem is uniquely affecting the same individual. And we need to develop collaborative works between these two programs. And that started the process of looking at individuals with TB, HIV, interactive disease. Amazingly, when I was in WHO, I gave a talk again in a world conference in San Francisco some years ago, in 1991 to be precise. And I told them in that meeting, in a plenary, in that same plenary, I was with the late Professor Jonathan Mann, who was then heading the global program on AIDS in Geneva. And I told the world that this interaction between TB and HIV is going to complicate problems of managing tuberculosis in the world, and particularly in sub-Saharan Africa. The message was carried all over the world, and it touched a lot of people. Consequently, the program in the Geneva of TB organized a meeting in London, and I was there, where TB then was declared a global emergency. That process turned all the world to recognize something ought to be done on TB. Because, ironically, the HIV programs were attracting a lot of resources. And yet the problem, which was affecting and killing their people, TB, was getting less resources. After that declaration, the world now woke up and put in a lot of money into tuberculosis as well. Now, in the process, I had some participation in the short chemotherapy trials of the Hong Kong, East Africa, and the British Research Council on finding the best suitable treatment duration of TB. The one now which is called short course chemotherapy. I was a principal investigator in Uganda. The results of this very beautiful study was then announced in Buenos Aires in 1982, where the world was now informed this was the best way to treat tuberculosis because the duration of treatment was reduced from the standard 24 months to just 6 months. And that improved the compliance, and now the patients did attend to the treatment. The other one, before I left again, I was a principal investigator for a study between the Makerere University and the Case Western University of the United States, actually looking at the interaction between TB and HIV. In fact, also along the process when I was in Geneva, people were discussing on the corridors, which country could we use to do the studies of mother-to-child transmission of HIV. I was just curious and I heard them talk. I said, that's a very interesting topic. I know a country which I know too well, where this could be a very good study because the cases are there. They asked me, which country is this? I said, let's try Uganda. The cases are there and the scientists are there. And indeed, I made the connection between the two colleagues from Geneva and the pediatric department of Makerere University. That, again, continued very well until Nevirapine came into being, which now saved a lot of children who were born to HIV-infected mothers. So, in conclusion, we have to be aware of shocks. I'm very pleased to be part of your team, this movement, because the world is one village as far as diseases are concerned. To talk about what is current, who knew a disease starting from one corner of China could engulf the entire world in less than 3 months? And of course, coming to even some of our countries, which were ill prepared. And many people thought, for example, this disease was going to devastate a lot of Africans. But somehow, I don't know, maybe the spell of the Almighty, He spared Africans. And we're now trying to cope up and see. But what is very important, which this has taught us, the collaboration across the world and working together has brought in a very quick response to a potentially destructive disease. So this movement you have, besides having telemedicine, where we can support each other, like when I was operating lonely in those that village hospital, I could consult others from elsewhere. How could I handle this procedure? Because I have the person at table. Similarly, the knowledge now coming out is very fascinating. Just yesterday, I was so pleased to hear that WHO has given an okay for a vaccine for malaria, a disease I've seen evolving since my childhood. I just said, my goodness me, this is a breakthrough. If this comes into being, you can imagine how many human beings are going to be saved. We have suffered with this scourge for many years. And this news, again, is calling on us to be together across the globe. Diseases respect no borders. We have had sporadic outbreaks of Ebola in some of our countries in Africa. It's the global concerted effort to come together and move in that aborted it from going to other places very rapidly. This is my journey in simple terms. But before I conclude, global health is fascinating. When I went to WHO, I became the leader in the Regional Office of Africa, who was a regional advisor for TB leprosy programs. And I helped the country set out programs in 46 countries, literally again starting as a single individual. But now as we speak, the office has got more than 20 people running that job. After doing that, I was then assigned to countries as a WHO representative. I was assigned to Angola, a very rich country in terms of minerals and even fish. But the country was engulfed in war, total war. When I was there, you could hardly move out of the city. Fortunately, there were peacekeepers which had been brought to help the country move on. And they had signed an agreement between the two warring factions to work together to put back the country to its footing. It was during that process, polio campaign was also on. Now here I was, a WHO representative. I was told the campaign is supposed to take place. I asked my colleagues in the office. Last year I was the campaign. They told me they just did a campaign locally where it was acceptable within the city. Then I said, what about the children in other parts of the country? Then I asked one of our country representative of UNDP. I asked him, these peacekeepers, where are they? He said, oh, no, they are scattered all over the country. And I said, then that means if there is war in those areas, the women and children must be in those areas. He said, that's correct. And I told him, I have a problem. Why don't we look at a possibility of using this massive human resource who are protected within those areas by the peacekeepers? And we try to tell them to participate in the vaccination and give these children hope and future. This touched this gentleman. He invited me to go to a meeting where there was the Troika meeting, and I was invited by the chairman of that meeting. And on the front desk, there was American ambassador, the Portuguese ambassador, because Angola originally is Portuguese. And then finally, there was also a Russian ambassador. Then on one side of the table was the people fighting the government. And then on the other side was this Troika coordinating force of the UN and peacekeepers. I was asked to speak. Fortunately, when they came for me, I thought of taking a vial of polio with me, vaccine. It was, to be precise, it was session 37 of their meeting. So when they invited me to talk, I told them, look, I'm in a wrong place. I'm not qualified to be in this meeting. But since you have asked me to come, I'm very humbled. I told them the history. I need to take you back in history. The world decided that smallpox must go. And they worked around the clock, everybody doing their part. And indeed, by 1979, the world was declared free of smallpox. I told them in 1988, the world came again that polio, which is crippling our people and children, giving them very bleak futures. We should work together and get rid of it. And what does it entail? Then I pulled out the vaccine and showed them. This is the thing. This must be dropped in the mouth of children who are below 5 years. During these campaigns, the moment we do this, we give hope to these children. The American ambassador immediately said, we support that process. Sidi the Russian also shook his head, we do, and the Portuguese man as well did so. Then the people fighting the government when they said we are willing to do it in areas where we are controlling. And the government concluded by saying, it is our responsibility to ensure that every citizen of this country is given health. Now the man was ahead of the Troika group, a special envoy appointed by the UN to head these peacekeepers. Said, bon, he was a Frenchman. Said, bon, doctor, we shall try to give you all the support. Indeed, the support was given, and that year, 97% of children all over the country were vaccinated. Why am I elaborating on this? Global diplomacy, global participation together, and people working for common good can bring a change. And indeed, one of my colleagues wrote an article on this and said, these social programs actually are a bridge for creating peace. After that, I was reassigned to Kenya as again a country representative. I gave them a lot of support again, all the time working between the global communities, the ambassadors and so on, and linking them with the country to give what is really making sense to moving health in that particular country. Again, shocks. That's when SARS hit. And there was a global meeting to be held in Nairobi on habitat, because that's the headquarters of that global body of the UN. Now, the director of Habitat calls me, doctor, they say SARS has started from the Far East and delegates are coming from there here. How are we going to handle this? Immediately, of course, I called my boss in Geneva. I tell this is the situation here. But then not only did I call, but I was telling her that please, probably what you can advise your colleague is that these countries have ambassadors represented here. Instead of delegates coming from there, they could send those materials which they want to showcase their countries on, and let the ambassadors who are already within the country do the job without getting people who could be potentially infectious, which is scaring the country come here. That's all the day. Again, having clear vision, focus, and understanding how things work. Finally, I was reassigned to Nigeria. Nigeria is the biggest populous country in Africa and also very prosperous. When I arrived there, problem of polio was a big issue. To such an extent, when the Minister of Health went to Geneva for their usual annual meetings, they singled Nigeria as exporting polio to other countries, to the Middle East and Far East. When that minister came back, he was totally perturbed. He called me again to a meeting, and we called all the ambassadors, and he told us how he was totally humiliated. He was feeling if there was a hall where he was seated, he was prepared to go. Then I raised my hand. I asked him a question. Honorable Minister, I think this is a very interesting situation, and it could be a wake-up call for us. You know what he told me? Dr. Ricky, there is a difference between whatever you're calling it, an embarrassment. I was totally embarrassed. But then I said, I think what I was trying to advance, Honorable Minister, we need to do something to handle the polio here. When we went back, he sent somebody to my office. I said, you want to understand what you meant by what you said. I told them, this is a local problem requiring local solutions. The people who in the north who are not accepting to vaccinate the children, we must understand them and find out why don't they do this. To cut a long story short, we had a visitation because they have a sultan, very, very highly respected leader of the Muslims in that country. He accepted to meet us, and I was one of the people he met. Fortunately, as we were traveling by plane there, he was also in the same plane, of course in business class, and I was at the back. So when the plane landed, we were held back in the plane until the royal person left. The reception, ululation, I said, what an opportunity. These people love this man. The following morning, when we went to meet him, I told the Sultan, I'm really very privileged to come to this holy place. What I saw yesterday touched me. These people love you. They really see you as their true leader. Why can't we take this advantage and you translate this leadership to help the children and probably women, and we give these children a chance to also live a normal life? He called me and asked me, what do you mean? I said, for example, if you told, they call the other ones Emirates, some knowledge of what actually is required to do, and the children get out to be vaccinated, this problem will be solved. He said, really? Next time, he organized and actually participated in immunizing his grandchild. And he told the other people, and the whole North turned around and started vaccinating children. When we visited him next time, he singled me out from the group and said, Peters, can you come to the front? How do you feel now? I said, sir, you have done it all. Again, diplomacy, working together, having clear knowledge of what you think can take advantage of without antagonizing anybody has made a difference in my life. I feel our young people can benefit a lot by listening to some of what we have said here.